Hello, good morning and welcome to the ISHACON 2026 at Ahmedabad. Hello Aital sir, how are you sir? Yeah. Hello madam, how are you? Hello ma'am. I'm fine. After long time. I'm so happy to meet my teachers from Manipal Institute. I think over here is registration is going on. Let's get registered first. For registration. Name Sadananda Gore. Nandgore. Oh, this is all computerized now. What a very good. So I got my registration. I scanner is also there. So here is registration, and here we are entering the hall. This is the door. This is the way towards the hall. See, all company displays are here. It's quite a huge hall. Dr. Vinay is talking about the European Federation of Audiology Societies and how it works, what are the programs under it, and how the structure of the organization is. And the aim of the presentation is that to establish um, that connection and expand the work beyond uh, Europe and have a collab with other countries to improve the hearing network. He's discussing about the test threshold equalization noise test, which helps in identification of the damage of the inner hair cells. So they have a project, I Hear You project. They try to find out what are the causes of hearing loss in school going children in Tanzania. And this was a completely funded project. So he mentioned that right now the research is and Europe and India is happening distinctively, but we have to work together so that it becomes more efficient. He mentioned that the India can be an important collaborator partner, and there should be a collaborative curriculum development which should be aligned with the global audiology competencies. So in the morning there were two sessions. One was on voice and another was on audiologies, the international perspective of the audiology research. It's a proud thing for Indians that Mr. Vinay has been the first president at European Federation Society to become the president from 2025 to 2027. So we have got some students also from us. So you're from which one? Shravan Institute.
From Ballari, Karnataka.
From Ballari. What's your name?
Santosh.
Santosh. Which year you are in?
I'm from second year.
Second year. You're from
I am Ashish Sharma. I am from Ballari, Karnataka.
Karnataka. And which year?
I'm studying in second year.
Awesome. So this is the first time for you in the conference?
Yeah, this is the first time.
First time? Okay. How are you finding this?
Yeah, it's good. I have not experienced this for a very long time.
In a long time. Okay, great. So I remembered my first memories of being students at ISHACON. So you'll have a lot of new learnings. Okay, best wishes. Thank you. This side is the breakfast area. I had my tea. Now going back to the hall for the ceremony.
Association for organizing.
This is a message from
Speech, Language and Hearing
Prime Minister Narendra Modi
ISHACON
for our
at
ISHACON.
Ahmedabad.
Now
world's
that's the
first
end of
heritage
the
city,
citation and
Ahmedabad.
oration
As we
award
run short
program,
of
award
time,
ceremony.
tea, coffee
And
is
now it
served
is tea and
outside.
coffee plate. And now I think the sessions will be start as per your area of interest. So for audiologists and speech therapists, there will be in the different halls. We have Nidhi with us, and she'll be talking about her presentation.
Yeah. Awareness of hearing loss in individual with diabetic mellitus. It's a survey study, and we took aim is to assess awareness of hearing loss among individuals with diabetic mellitus.
So 220 diabetics, you sent a
220
questionnaire
questionnaire
and you
and
asked, did you, no,
face to
again,
face also
face to
we.
face also asked,
Uh,
and then you found around 51% of them
yeah,
was above average. But
above average.
so around 50%
They
were
are
knowing,
aware, but
they are aware that they have a
they
hearing
didn't
loss.
do anything for the hearing,
Hearing loss. But they are aware
conservation.
that they have hearing loss.
Uh,
But were they aware that they were having hearing loss because of diabetes?
because they didn't know the what the cause of the
Cause of the diabetes.
hearing.
Okay, but they
Hearing
had a
loss.
hearing loss. That's what they are aware.
This study was on the topic of audiological profile of children enrolled for cochlear implantation. This was done, it's a retrospective study.
We have developed an communication profile
Put it near.
to help identify the language profile of a child with visual impairment and complex communication needs. We have
What
developed
is complex communication needs?
a child with visual impairment who has trouble with normal language.
Okay.
So for them, it can they will have difficulty in coping with other forms of communications too. If they have an
So if somebody has a visual impairment, will they also have a language challenges?
not necessarily,
Not
but
necessarily.
this is an like very rare population where both are affected.
Okay.
So for that population, we are developed a tool. It's this assesses all these characteristics. So
Okay. So what are the tests you have done in this?
uh, we have developed a test. We have
You developed the
valid-
test.
Yeah.
Okay.
We have developed it and we have validated with professionals.
Okay.
And we have done just an initial feasibility population study to see if it's applicable to in a real life context or
Okay.
not.
So I am a
with
speech
that-
therapist. I
Okay.
don't deal in visual impaired children. If I get a visual impaired child, then what should I expect? Will he have a language problem?
Without this profile, we will like work on like the traditional goals and such what we do. With that, with this, we can adapt our therapy goals so that it is more suited to the child.
So what is adapted in this?
So we can use tactile modalities, auditory.
This side there are moderators, and they are evaluating the uh, research paper by the students. I envy them because I could not never present at ISHACON. It's very good. I think there are 4 booths total where they are presented to the moderators. So Dr. Mukherjee is talking about the using cognitive behavioral therapy as a treatment for tinnitus. Generally, CBT is taken as a psychologist role. So they have studied P300 after doing the CBT, and they have found that there is improvement in the P300 amplitudes.
But you have to restrict the association with this thought. So that is called the restructuring. So how CBT works? So you have to first understand the problem. This particular hierarchy of this anxiety, you can control based on lot of methods. I am coming in the next slides. I failed this test, so I am failing. So you have to break the chain by stopping the thought. So it is called thought stopping methods. Another important part that you can use hearing aids definitely for hearing impaired person.
We here is one of the important sponsors of ISHACON, so they will be talking about their products.
So as Indians, हमको क्या चाहिए कि India excels in every field. We want Indians to set benchmarks for global.
So just now we had 2 presentations. One was with about the We Here, Indian brand trying to solve this global problem. It's a very good initiative. They are already into the bone conduction devices, now coming up with the air conduction devices. And there was a presentation by Starkey who talked about the AI chip. They called it neuroprocessor. I think that again will improve the patient's speech understanding. It's time for the lunch break. Let's the line for the food. Oh my god. food is good. I think only veg is there. इसमें एक item है called as undiu, which is quite tasty, which is good.
Hi guys, please follow first channel
Yes, yes. Please
and
subscribe.
please subscribe to my channel as well. It's @hearmeup.
हाँ, उनका भी देख लो. पहले मेरा सब्सक्राइब करो.
प्लीज मेरे सब्सक्राइबर्स इनको करो, इनके वो मेरे को करो.
हाँ, इसको एडिट कर देंगे. So guys, हमारा लंच हो गया है. मेरे साथ विशाल है.
हाय गाइस, मेरा नाम है विशाल और मैं भुवनेश्वर से हूँ और हमारा कॉलेज एस्ट्रीनेट तार है, सेंट्रल गवर्नमेंट का है. आप सभी आइए और सर के जितने भी वीडियोस है उस पर लाइक शेयर जो भी करना है कीजिए, सब्सक्राइब भी कीजिए. सर
सब्सक्राइब क्यों नहीं करो? सब्सक्राइब करो सारे लोग.
सर बहुत अच्छे गाइडेंस करते हैं. अभी तो उनका स्टार्ट हुआ है अब पढ़ाई, मतलब क्या बोलते हैं, ऑनलाइन पढ़ाई. तो आप सभी को मैं प्लीज़ 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 सर जितने भी लेक्चर्स देते हैं उन पे अच्छे से लाइक कमेंट शेयर कीजिए.
इसका 50 रुपये अलग से मिलने वाला है.
सर इज़ वेरी इंपॉर्टेंट टॉपिक पे ही डिस्कस करते हैं.
बाप रे,
मैंने बहुत सारे इनके वीडियो देखे हैं.
बहुत अच्छे स्क्रिप्ट पढ़ी है तुमने. अभी इम्पोर्टेंट टॉपिक है रिगार्डिंग द OTC हियरिंग एड. वी विल डिस्कस अबाउट what is it an opportunity, is a threat, especially for private practitioners. Let's see if the session has started.
Seriously, and you would always say we see a lot of plane crashes, right? And can we have a simulator trained pilot fly a plane? So that's the answer to OTC. I would say that's the reason I say professionals are always important in the channel, because they know how the things have to be done. You cannot just train on a simulator and fly a plane. So that's importance of professional. It would be easy like driving a car. You can have a driver or you can drive on your own, or you could be just doing OTC. So it's like you have an eye infection, you just want to go and pick up a medicine and put in your eye. You don't even know what you're doing. And if you have over-the-counter hearing aids, I have known cases, and I have one known case of a very well-known personality. You have seen that personality on television many years. He came to me, his wife, gradually hearing loss, somebody without seeing fitted a hearing aid. The hearing loss went up, fitted a more powerful hearing aid. Okay? And this is a true story. And later on, they reached very late to AIMS and they found that there was a tumor growing on the acoustic nerve. Now listen, you guys have to know, and the whole world needs to know that the science of hearing has to be de-interface. The audiologist has to be there. You cannot do that without it.
As a manufacturer, our job is to ensure that when we are giving a dealership to any of the individuals, that person should be qualified.
I have a comment to make. Okay, all private practitioners have their responsibility to work for advocacy and awareness. Don't shell out the commission to others, save that money, and 10% of your revenue if you invest in advertisement. 5-kilometer radius of your practice will do wonderful things. If others do and I will not do, I have no right to tell you, Isha, to CAEPs, what is my responsibility. If I am in the business, I am working to earn the revenue. It's my responsibility to build up the clientele also. Nobody is going to send the cases to you. You have to generate.
The concept of electroacoustic hearing, where you have a electrical in the region where the hair cells are severely performing impaired, but almost preserving the hair cells in the normal place in the basal membrane. So this is called preserving the hearing. If you have to preserve the hearing, you should also preserve the structure. So I want to show you a small endoscopic view of scala tympani. Now today we have precised tools also to look at the intracochlear microstructure. So what you see here is an endoscopy of the scala tympani, and you see here on top is the basilar membrane and the spiraling glial cells over here. So the technology is more precise, where you can also look into the microanatomical variations inside the cochlea. Now, so it is more important to understand dead ear. The deaf ear doesn't mean it's a dead ear.
Basically, I'm going to talk a little bit about what is all of you, a brief introduction about particular auditory evoked potentials, and then why should we use this CAEPs in cochlear implant candidacy, and what evidences do we have to show that, and what is the protocol and the procedure that is used clinically for doing particular evoked potentials. And there is a lot of evidence in literature showing that it has clinical utility. So the clinical applications of particular evoked potential includes threshold estimation and assessing severity of auditory neuropathy spectrum disorder. It can also assess central auditory system. And the last one is assessing benefit from hearing devices, particular auditory evoked potentials, because all of us know that there is stress and early identification. So we have now a rule where all infants should be screened before 1 month of age.
Also, like face challenges in delivering consistent, family-centered and long-term care, particularly in case of resource-limited settings and especially during transition from the clinical settings to academic or school-based services. Profound, severe to profound hearing loss and early intervene, regularly attending therapy. However, limited progress is seen because of behavioral or attention issues, has been referred to occupational therapy for sensory integration, and parents have not been attending on a regular basis because they see that they are.
First of all, the mapping which I use with this child was the same as any other case because objective measurements were used because being the child being very young, the behavioral responses were not very consistent.
That's the end of the first day of the ISHACON. A lot of learnings and a lot of great moments. It was nice to meet friends and teachers again. Unfortunately, I lost the charger of this mic. I don't know if I can record for tomorrow. If I can't charge this, I can't record it. So let's see. If possible, I will record for tomorrow, or otherwise, this is the last vlog for the ISHACON. Please subscribe the channel and share with your friends. Thank you. Bye.